right. Well, we have Dr. Craig Wax and Dr. Westby Fisher with us here. Gentlemen, welcome.
Hello there. Thanks for having
Thank you
us.
so much.
I'm glad y'all can make it. Doctor's life is always a busy one.
Sorry, guys. Had to do a little work for a living.
Well, I appreciate you taking out the time today. And the topic of this one is maintenance and certification. And I took a deep dive into this earlier, and this is a mess. So, yeah, you got a lot of work cut out for you on this one. And it seems like to me that this is a very important thing, that there's a lot of unneeded regulation and a lot of hoops to jump through that I think just doesn't need to be there. And I think that's what the campaign is about and the lawsuit. So, without me trying to get into it, Dr. Fisher, if you would mind just to give an overview of what it is and what we're trying to accomplish with this particular lawsuit, and just kind of take it from here.
Well, thank you so much, Brennan. A couple things for folks to understand. This is not just one lawsuit. This is a whole series of lawsuits that have been filed against the American Board of Medical Specialties and their member boards. Really, the first one started back in 2004 by the American Association of American Physicians and Surgeons. There was an antitrust lawsuit that was filed there. That's been weaving its way through the courts. And that suit is still pending. We don't have final resolution of it either. Perhaps the largest cluster began in December of last year when the American Board of Internal Medicine was sued for a claim of antitrust violations due to illegal tying behavior of tying this maintenance of certification to initial certification, which we all had to pass at least one time, basically to show the adequacy of our residency training. And then in 1990, mysteriously, the American Board of Internal Medicine decided to have repeated testing, claiming that doctors needed to keep up, that we had to, medical knowledge was changing all the time. And that was despite the fact that we already had to do continuing medical education for keeping our state licenses at each state in the United States. So maintenance of certification mandate became required for all physicians that wanted to remain board certified, because they switched it from a lifetime certification to time-limited certification. And initially it expired every 10 years. And as time has gone along, we now have to make payments every 5 years to acquire so many mock points that they want us to do. Those mock points used to be 100 points over 10 years. Now it's 200 points every 10 years, which means twice as many payments for continuing education that the American Board of Internal Medicine says that we have to do, and as opposed to the continuing education that we ourselves believe we need to do. And the remarkable thing is that physicians have always believed that they're capable of making life and death decisions every day. But when it comes to picking our own CME, according to the American Board of Internal Medicine, we're incapable of doing that. And therefore, we must follow what CME they want us to do. So it's a very strange mandate indeed. And unfortunately, because they no longer recognize their board certification as valid if you don't pay them on a repeated basis, they now, basically what's happened is they worked with the hospitals and insurance companies that we can lose our hospital privileges or insurance payments if we don't keep up with these payments to the American Board of Medical Specialties member boards. So because of that theoretic illegal tying and antitrust violations, the American Board of Internal Medicine in December was sued by 4 physicians, all internists, 2 of them gastroenterologists, another was a general internist in Detroit. And these people all had harms imposed by them. I'm sorry, the last one was an infectious disease specialist, but they all had lost their privileges or were unable to receive insurance payments or couldn't get a job, lost income because of the restrictions required by payment for maintenance of certification. And that's the grounds of probably the biggest part of all these lawsuits that have been filed against the ABMS member boards. In addition to the antitrust violation, there's a monopoly charge claim that was filed against them. Also a racketeering claim against the American Board of Internal Medicine. And because of the exorbitant salaries, the lavish extra perks that these board members have thrown on themselves, unjust enrichment was also added to the claims, which are state required things. These are supposed to be nonprofits and not a place to be making large sums of money. And I think it's important people understand that this is much more than physician testing that is being sold. Basically, when we register all our data for these tests, you can't read a text and get credit for reading the text that they send you and taking the test. You have to be on a computer in order to acquire your mock points. And that's because they're measuring everything you do on that computer and selling that data to third parties. So it's also about our privacy as physicians, not to mention basically a heavy-handed way to make sure that they are guaranteed their payments on a regular basis because they tie it to our employment or insurance payments. Only the ABIM, which is the largest member board of all the 24 member boards, the American Board of Medical Specialties, has the racketeering charge currently. But the American Board of Radiology was sued, and as was the American Board of Psychiatry and Neurology. The board member of the American Board of Psychiatry and Neurology made over $2 million in a single year. So we have to worry about what these people are doing this for, and it certainly seems like it's much more than to assure physician testing. These people are making large sums of money for themselves, but probably the biggest problem with the maintenance of certification mandate is it can affect the physician's right to work. So despite us working and getting the continuous payments and all of that, the real problem is that we can actually lose our job unless we pay this money, and that's where the antitrust claims sit. And there have now been additional suits filed against the American Board of Emergency Medicine and the American Board of Anesthesia. And I think Craig has information also regarding the American Osteopathic Association. He was involved and actually was a plaintiff in the lawsuit against them. So Craig, do you want to fill us in on what happened there?
Oh, thanks very much. Again, I appreciate Citizen Health hosting this conference, and certainly the ability to work with you, Dr. Wes, with regard to the mock issues, you being an MD, me being a DO, and that means that there were different mechanisms for certification primarily, although there was some crossover. You had mentioned ABMS, and on the DO side, there was the Osteopathic Graduate Medical Education System, and as of next year, they're coming crashing together. That it seems from downward pressure from the government with regard to residencies, that MDs didn't have enough residencies to suit their schools, and the osteopathic profession had more residencies and students than to suit the amount of physicians that could possibly be put through. So what happened was both organizations are coming crashing together with ACGME as of next year, which I think is an issue. If the MDs don't have enough residencies for their students and DOs don't have enough residencies for their students, then how are putting them together in one system with one central power core going to address that need? It doesn't make any sense to me. At any rate, you've done a lot of great work, Dr. West. Thank you for that. also building on the original AAPS lawsuit that unfortunately languished for years in the same area, Chicago, Illinois, again for restriction of trade. Because as you so well point out, that a physician that finishes residency, even when you complete residency, if you're not board certified and recertified every 7 to 10 years, or at the whim of the boards, that you can't get a job, you can't participate in a government program like Medicare or Medicaid, hospitals won't hire you, and being in private practice, there's no real successful way to function with any of the current payment mechanisms. And that's certainly a big issue. So we took that issue on in 2017. 4 DOs from the New Jersey area sued the AOA, and as you had talked about illegally tying, that was a good segue to this with regard to the AOA. In addition to saying as of 1997 that we all had to be recertified, and that program has taken more time and more money as they come up with more things for us to do, despite the fact that we all do yearly CME at our discretion and per their criteria. So in addition, our data has to be reviewed by outsiders, and that costs money. It costs to take the periodic testing that it could be a one winner-take-all test for thousands of dollars in a place that's not near to you, or it could be online, as they're trying to do it now to make it more humane, but it's still not necessary. So 4 of us plaintiffs sued on behalf of the entire class of all those certified on the DO side, and after 2 years, we had reached a settlement with the AOA. So what they had done, in addition to what the ACGME side had done, or ABIM, I should say, had done, they also tied our repeated board certification to membership in the AOA, which was approximately $750 a year. And what relationship did that have to our education and board certification? None. But it was a source of revenue for them, in my opinion. And if you've got something good, of course we would pay, we would come, you would support us, and life would be a dream, sweetheart, with regard to physician governance organizations. However, when you don't support us, you're not listening, and you're just forcing us to pay, well, that violates not only federal law, but also New Jersey state law with regard to anti-racketeering. So we brought this to a close in the past year, that starting in the current following year, that their dues would be reduced by $90 for those who wish to continue, but immediately the tie is broken that in order to maintain your board certification, you don't have to continue to be a dues-paying member of the AOA for the previous 3 years, because that broke state and federal law. So that was taken. So fortunately, we were able to draw, I guess, what they call in the legal profession first blood with regard to these sort of edicts coming from the top that violate both state and federal laws and our right to practice autonomously. In addition, the AOA will offer CME as part of their program. If somebody wishes to be a member, they will contribute $2 million to an osteopathic awareness campaign, the likes of which I've never seen so far in the year that this is supposed to be available. Also, CME can be online as opposed to being in person at their conferences, which they sponsor and make money off of. Also, there's supposed to be a committee of private physicians to be advising the AOA board, and I have not have any information about that, whether or not they've established that. I certainly have not been asked to be a member, although I would certainly consider membership in the AOA to actually have a voice, certainly. And the other thing is that people certified prior to 1997 were guaranteed lifelong certification, and then all of a sudden they took that away. And I know on the MD side of things, they've successfully taken that away, and that's part of what your lawsuit, I'm sure, alleges. Having said that, on the AOA DO side, that they are guaranteed lifelong board certification. They can say they're not continuing with their program, but they will not have their board certification removed or forcefully taken from them, endangering their job and their ability to practice osteopathic medicine in whatever capacity they choose or practice. So we're actually interested now, because we haven't really seen any resulting anything from the AOA. In fact, a lot of DOs out there don't even know that this case has gone through. I mean, the AOA had, whenever there's a settlement or a judgment, they have to make everyone in the case aware, and that includes all of the class of all DOs and MDs that might be certified by them if that were the case, to be notified of this and to have all of these settlement terms available to them. And to this date, I do not have evidence of either. So if anyone out there that's DO board certified has any evidence that they are or are not abiding by these things, please let us know. You can go to the letters IP, the number 4, the letters PI, so ip4pi.wordpress.com. Go to that blog, and in the search bar, type in AOA settlement, and you'll find the settlement terms. And if you would kindly feed back to us as to whether or not they're abiding by those terms, it would be very, very helpful, because I remember the judge in the Camden courtroom, in the federal courtroom in Camden, New Jersey, said that because I was skeptical as to whether or not, despite having a verdict, not a verdict, but a settlement, that they would comply with these things, although they did theoretically. And the judge told me that he would want to know in straight up fashion whether or not, because he would not take kindly to someone not going along with his settlement. So that's where the AOA part stands. It'll be interesting to see what happens as of next year, as the AOA graduate medical education programs will be absorbed by the ACGME. In fact, the president of ACGME next year is going to be a DO. So it will be interesting to see how all of that works. And finally, as I was saying, it'd be important for us to hear anything from any DOs or those certified by DO groups out there as to what's going on. The last thing that I was going to say, and Dr. West has talked about this top-down management for dollars, as it were, to manage others at our peril and cost, certainly, and with no data to show any justification or any positives to come out of it. On the DO side, the American Osteopathic Association owns all its member boards. A few decades ago, they took them all in-house. So to me, it's beyond collusion, potentially, to the point of monopoly, basically, because there are multiple boards, but all owned and governed in the same way by the same organization. Thank you.
Thanks, Craig. I think your point's well taken. We have to understand the American Board of Internal Medicine came from the American College of Physicians and the American Medical Association. They were basically derived from that organization, and they've worked collectively to begin to make sure that everybody followed in line based on their own specialty, certain criteria set forth by the American Board of Medical Specialties. The American Board of Medical Specialties also owns the Maintenance of Certification trademark, and I think it's important to make sure that people understand kind of where all these lawsuits stand at the present time. So I'd like to quickly run down that. Perhaps the largest blow recently was a judgment made by a senior judge in the Philadelphia court system against the American Board of Internal Medicine that initially dismissed the tying claim and the unjust enrichment claim against the American Board of Internal Medicine with prejudice, meaning that the Plaintiffs could not go back and sue on those grounds. However, did allow 14 days for the plaintiffs to amend their complaint under the monopolization and racketeering charges that were filed. In other words, there was probably enough that he did not feel comfortable dismissing those two charges completely with prejudice, and but they only gave him 14 days, and it's unusual for a judge to give plaintiffs such a short period of time. Usually, it's a month to amend your complaint before they dismiss or write a final summary judgment on the case. In reviewing those claims, there was some concern about the judgment that came down from the plaintiffs. Obviously, they were disappointed to learn this, and because I think most of us who have been through this process, and people here should understand that I am a grandfathered internist, but I am not grandfathered for cardiology or cardiac electrophysiology. So I straddle the fence. I've been practicing medicine and understand the changes that have occurred throughout this cycle of going from lifetime certification to time-limited certification. And for that reason, I think the entire concept was lost on the senior judge. I don't think he really understood. And there were some procedural issues that the plaintiffs took issue with. So they decided not to amend their complaint. They didn't think it was reasonable to do so in 14 days. And instead, once the final summary judgment is filed, to the best of my knowledge, they are planning to amend or to appeal the full complaint at the appellate level. So I think we have to wait and see what happens once the final judgment comes as to how the legal wheels will turn. But it's clear that no one thought this was going to be an easy battle. The American Board of Medical Specialties and all of their collaborating entities, which includes the American Hospital Association, the American Medical Association, all of whom make up the ACGME, including the ABMS. They'll stop at nothing, basically, we think, to continue this process for physicians. So we'd like very much for things to go to the appellate court. It's amazing that physicians have not gotten their day in court, despite very sound filing that went forth. But nonetheless, we have to abide by the rule of law as it currently stands. So I think it's important people understand what the plan will be, as to the best of my knowledge, regarding the American Board of Internal Medicine. The American Board of Radiology and the suits against the American Board of Psychiatry and Neurology, the suit against the American Board of Emergency Medicine and the American Board of Anesthesia, as well as the American Board of Medical Specialties. Those suits are all fully briefed, but no ruling has come down on them yet. The hope is that by the end of the year, we'll start to get some of these suits coming in over time to learning when and if any of those suits get to go to court and go to discovery. I think that the board members will be very interested in not allowing this case to go to discovery. And that will be up to the plaintiffs themselves to decide if they want to continue or settle. We can only hope that they'll want to go on and to court in order to get all of the issues brought out. But if any one of these suits wins, it will help the other suits that are filed in court. They are very synergistic suits, and they form a precedent going forward. So you can be assured that the American Board of Medical Specialties is using the ABIM ruling as a precedent for other cases that are already filed against it. But there have been counterpoints made on both sides. So not being a lawyer, I have to leave it to the legal team who's working on these. And I think there's quite a few legal teams since these lawsuits are filed nationwide, working on this very issue. But clearly there must be grounds for a belief that these are really cases. Otherwise, we wouldn't have this flurry of lawsuits being filed. The Practicing Physicians of America, which is an organization that I helped co-found, and Craig is one of our board members, as is Marion Mass, who's been on earlier. And we've got Judith Thompson, Naran Al-Agba, and Brian Dixon all on our board. And all of us got together. We are very disparate people. I'm a subspecialty physician, cardiac electrophysiologist. We have 2 pediatricians, Naran and Marion. We have a DO, Craig, and we have a family practice physician with Brian. And Judith, our president and CEO, is our kind of master of ceremonies, mother superior breast surgeon. So using those folks, all of us firmly believe that physicians should be allowed to have autonomy. It's in our patient's best safety, in our patient's best interest for safety and quality of care. We need to have the ability to learn what we feel we need. These boards have no idea our scope of practice, what our practice situation is like. They have a one-size-fits-all metric that they're thinking that a computer and staring into a computer screen and answering a question or two based on the latest literature is going to make us better doctors. I mean, it's ludicrous. So unfortunately, we have the entire academic medical community siding with the American Board of Medical Specialties. When there, as Craig mentioned, absolutely no proof that recurrent maintenance of certification does anything beyond what continuing medical education does and has already done for us throughout the years. And I think that this is going to be an important fight for us. I think it's critical that doctors step up. It's just amazing to me that we haven't even had every doctor contribute $10 to our Gofundme campaign, which we'll put up later with a link to support this effort. When everybody, I mean, we've done polls. I got over 7,000 physicians, and 80% of them said they hated maintenance of certification. And they thought it was one of the leading causes of burnout for them and their family, the time they'd have to pull away. I mean, we have to stop what we're doing in the middle of patient care because we're about to lose our privileges. We have to go buy this $1,600 packet of information. We have to cram it. It's like the Encyclopedia Britannica. And then take time away from our family and our lives, not to mention our patients, where we have to go off to a testing center or do some other testing, or do it every 2 years, or every 5 years, every year. I mean, it gets ridiculous just because these guys want to maintain their cash flow. And I think that it's disruptive to patient care. It's distracting from patient care. It's not proven to improve patient care. And the worst part of all of this is the very undisclosed things that have happened with our data and with our personnel, in our personal lives when we do these tests. It's all being sold for large sums of money. And I think, we have to have people who push back against this somehow. Otherwise, we're going to basically have ourselves relinquished to mid-levels. Not that those people aren't helpful, but they don't have to do this maintenance of certification stuff. And we're seeing a lot of doctors leave the practice of medicine, become suicidal, very disenchanted as they're overwrought with the work that we have to do just to satisfy these bureaucratic, unproven needs. So please, folks, if you can step up that are listening in, get your friends. We don't necessarily need everyone here. If every person would turn to 10 people and have them contribute a few bucks to the GoFundMe, we should be able to get over we're only asking $400,000. These lawsuits, probably the ABIM lawsuit alone with legal fees is probably going to approach $10 million. We're not asking doctors to contribute that much. And I think that if we, can work on trying to get this initial money, it helps us get experts. It helps us get legal opinions in support of the plaintiffs that are working very hard and exposing themselves for this effort. So this is going to be a big piece of what we as doctors and fellow colleagues can do to help end maintenance of certification nationwide. Any other things? I noticed one of the other things that came up, I think it's worthwhile to mention that a lot has been done outside of legal means to try and prevent this monopolization of our board certifications. So we've tried to go to the AMA and have put through resolutions there without success. The National Board of Physicians and Surgeons is an alternate board created by Paul Tierstein and many of his colleagues. Paul Matthew comes to mind from Mass General and the Brigham. Those guys have worked tirelessly to create an alternate board that costs a fraction of what the American Board of Medical Specialties Maintenance of Certification product. They basically verify continuing medical education credits and give you a certificate saying you've participated in continuing medical education credits. It's like $85 a year, something like that. It's not very expensive. Obviously, if physicians were to migrate there and force more and more hospitals at their own place to accept the National Board of Physicians and Surgeons, that would also put pressure on the American Board of Medical Specialties and divide up their monopoly over the maintenance of certification program. But as it stands right now, unfortunately, too few hospitals are allowing this alternate board to be used for accreditation purposes or for physicians on their staff. And a lot of that is because maintenance of certification and training programs require ABMS board certified physicians as program directors. And the National Committee on Quality Assurance, headed by Margaret O'Kane, Margaret O'Kane, they certify which insurance companies can receive monies from the from CMS under the new Affordable Care Act. And then wouldn't you know that the board member of the National Committee of Quality Assurance happens to sit on the board of the American Board of Medical Specialties. So there is a collusion there, and it's not surprising that insurance companies, as a result of that, require ABMS board certified physicians in order for people to receive payments from those insurers. And Blue Cross Blue Shield and Aetna are two of the biggest ones that I'm aware of that have that tie. So this is also part of what's going on with the ABIM lawsuit. Hopefully, if we can move that into the courts, we'll be able to expose this collaboration with the insurance companies, because I think that's a big piece of why hospitals use it as their excuse. Well, if we can't get insurance payments, we're going to have to not take the National Board of Physicians and Surgeons. So I think it's important that people understand that particular collaboration exists. So I think, we have to appreciate that this is all part of the way to control physicians. In the United States, we have the magic pen that writes orders. We have to refer people and have the ability to send people to other places. It is in hospitals' best interest to have power over their employees and to keep the physicians under one roof and to refer internally. They are able to increase their profits as well. So the hospitals aren't totally innocent in this whole process either. And the insurance companies are part of it. Pharma's probably playing a role because they can't get into doctors' offices in many of these places. And many of the teachings that go on in the ABMS world that are forced on physicians are in part funded by industry. So to make sure that they can get their particular product in front of a physician. So all of these things are areas that we need to, appreciate. This is not going to be a simple battle. It's going to go on for a while. But right now it looks like hopefully by the end of 2020, we'll start getting some resolution to some of these things.
Thanks, Dr. Wes. If I could jump in for a second.
Sure.
Thank you. Excellent work as always. It's a pleasure and privilege to work with somebody who's as driven, methodical, and passionate about doing the right thing as you are, especially since you're partially grandfathered, which is interesting. Very interesting conundrum. So you can see both sides, and I commend you and appreciate working with you on this. So take-home messages from this, just to summarize, as I have to run and perform some procedures, not catheterizations, but other procedures. One is the National Board of Physicians and Surgeons at nbpas.org. They are also the National Board of Osteopathic Physicians and Surgeons. They will certify MDs and DOs by their yearly participation in CME, period, as it should be. None of us physicians says that we shouldn't do yearly or ongoing sorts of self-education, and the NBPAS and NBOPAS recognizes that and wants to make that the standard and give the other certifying boards a run for their money, and more programs are recognizing them. The other thing that Dr. West mentioned was Practicing Physicians of America, which I have the pleasure of sitting on the board with other wonderful people like Dr. West, Dr. Marion, and Dr. Judy, Dr. Brian, and all the adjuncts that help us with this ongoing issue. If you can, join PPA. It's no cost to get registered with us, and it's at practicingphysician.org. It's hugely important. Not only will you have all the information that we're talking about, you'll be able to interact with us and be able to help us to move forward on all of our own issues that we all need to move on, to be able to make physicians independent again and help us to serve our patients in the way that we need to do it, that is time-honored, respected, and in a non-profiteering fashion, let's say. And lastly, with the AOA lawsuit settlement, if you could go to ip4pi.wordpress.com, you'll also find lots of mock things in addition to Dr. West's blog, which is very, very good regular read. Where he finds time for all these things, I don't know, but we all have to find time to fight the good fights as we've done now for several years. But I need to find out to let our legal representation know whether or not the AOA has kept up their part of the settlement bargain. I have no evidence that they have, and I need to find out either way. So if you could get back to us with details, the best way to do that is through Practicing Physicians of America, which is on Twitter at PPA_USA, where there'll be links to a lot of the things we've spoken about. Plus, we're at Practicing Physician, singular, that is practicingphysician.org. Thank you, and again, allow me to run. Be well.
Thank you, Dr. Wax. Appreciate it. All right. Well, we have, I think, Dr. West, I think you've been answering these questions.
I've been trying.
Yeah. All right. All right. Well, there's one thing that I want to bring up here, and it is the Gofundme campaign. I'm impressed by this, and I just like the concept of having a lot of people come together for one cause and contributing a little bit, whether it's time or effort, or in this case, dollars, to the effort. And it raised close to $400,000. And if you look at GoFundMe, about a third of all the money raised is for medical cases, whatever that may be. I'm not sure if this actually falls under that, but I'm curious to know. There's about 1,600 people that have donated. That's a very small percentage of all the physicians out there. If you look at, just say 10% of all physicians right now, around about 100,000, if everybody just donates $100, that's pretty much all we need for what you said, $10 million. A little bit more than that, there could be a lot of change happening. There's a lot of power behind capital, coordinated capital. So I'm kind of getting to what else can we help with as far as crowdfunding. Do you see any other thing that we can kind of tap the power of the crowd and organize around?
Great Great question. I've been doing this now almost, 16, 18 months, something like that, a year and a half. And it's actually quite disappointing that the only amount of money we can raise is about not even $400,000. And that's really all we're asking. And why is that? I think it's important to understand that half the people that have donated, just about half, are doing so anonymously. People are really threatened by the American Board of Medical Specialties. They're threatened that they might lose their job. They're threatened that if they speak up against the quote machine that, they're vulnerable and they don't want to lose their income for their families. They don't want to jeopardize their employment. And I get that. I think that's a big piece of what's going on. I can also say that I think we are in an echo chamber on social media. I think that what we don't have and what we need are large email lists. We need a lot of people out there spreading the word. And I think we have to use good old garden variety snail mail to do so. I think that would help. I also think, it's interesting. I'm in a group of over 40 physicians and probably only about 5 to 10 maybe have donated. A couple of them are grandfathers, which is heartening to me because they know that this is really a scam. And they want us to fight the good fight. But it's surprising to me, these younger physicians, a lot of people don't, first of all, they go, well, it's, look, it's only $2,000 every so often, no big deal. But we have to understand that those prices have gone up 352% since the year 2000. And they're only going to grow, particularly with all this legal activity going on. And I think that that's way above inflation, and the time away from family means something. The loss of autonomy and feeling extorted that you have to make this payment to keep your job just isn't right, and we need to push back against it. It is amazing to me that we have people that have positioned themselves with such authority for political purposes, really. And I think this is a big push toward the single payer model, if for lack, and I think it's going to actually be the capitalist model in America. I think, I don't want to get into whether single payer is a good thing or a bad thing, but I think we've had a very large push to trying to have a lot of different things done in healthcare. That the insurance companies realize that this is a bubble and they need to get rid of the risk that they have to assume. And more of our payments are being borne by our citizens. And I think that there's a reason for that. They are trying to get rid of the risk to the insurance companies and give it to others. There's such obfuscation of pricing. We have no idea what things cost. And unfortunately, physicians and our data are critical for all of these algorithms that are being developed for artificial intelligence. And mock is a way to keep that database up to date as to who's actually practicing, what they're doing, how many procedures they do, et cetera, et cetera. Your social security number is being sold. All that information is being used for other people to covertly ration care so that they can make huge profit. And it's a very complicated, tortuous thing to understand how mock fits into that. But that's why we need these lawsuits, because they will help put sunshine on the pricing issue and how this data is being used for the benefit of the large bureaucratic machine that is the insurance companies and hospitals that are working behind the scenes to keep their profits high and the business of medicine lucrative for them. So unfortunately, this is happening at our patients' expense. We unfortunately are left no choice but to pay into this system that is perpetuating this problem for our patients. And I think it's almost paramount on all of us to do what we can to help our patients push back against these problems. And I think mock is a way for us to begin to understand how our data are being used.
Yeah, that's something that I think is being discussed now, because in the past it has not. People have not thought about their data, but with Cambridge Analytica and a lot of the consumer data stuff coming
Right.
out, people are starting to say, well, yeah, our healthcare data is being used in the same way. And I was reading an article about when you get a prescription filled, before you leave CVS, your data is already sold. It's that quick. Like before you can get out of the parking lot. And you were being taken advantage of with our data, or our data is being used to profit and we're not getting a dime from it. That's another conversation there. But we're looking at this mock lawsuit for the physicians coming together to basically get rid of this. Is there a group that entirely focuses on lawsuits, fighting these types of mandates and regulations? Really just a law firm that's sole purpose to do something like this?
To the best of my knowledge, there's no single law firm that's doing this, but certainly there are law firms who specialize in antitrust and business antitrust law, that kind of thing. There are a number, obviously, of lawsuits or law firms that are involved in these lawsuits that are underway. It is very hard in the city of Chicago to find a law firm that isn't affiliated with the American Medical Association, because they use everybody in Chicago, all the big law firms. So it is amazing that there's one law firm from Chicago who's kind of taken on the machine here with at least 3 of these suits to date. But there's also a law firm in California, and California may be a more favorable environment for these antitrust suits. There was recently, beginning of October, just earlier last month, the lawsuit of an internal medicine physician, a Puerto Rican internal medicine physician who was falsely accused of cheating on his ABIM exam. His countersuit was just filed in Puerto Rico. And you can bet that they're going to push back hard against that. But there is all the principals of the American Board of Internal Medicine who helped begin this maintenance of certification are named in that lawsuit. And it'll be interesting to see if they all get free funded flights by diplomats of the ABIM to Puerto Rico in the middle of the winter to undergo that, to get their depositions filed down there. Certainly they'll probably use it as a vacation spot, just like they took away $6.5 million of our dollars to the Cayman Islands. So, unfortunately, I don't know how the ABIM is going to withstand all these lawsuits and the cost of what they must be costing them millions and millions of dollars. But I think we have to realize that these things are going to be a challenge going forward. And with that, I've got my dog going crazy in the background.
All right, well, we'll go ahead and it's about the hour mark, so we can wrap it up here.
Okay.
If you have any closing remarks, go ahead. But if not, we can just close it up and move on till the next day, till tomorrow. Anything to add? Any other last minute questions? I think let's go. Yeah, I think everybody else is
heading out. Thank you all for your time. I appreciate it. And thanks, Brennen, for moderating this. It was great.
Thank you, Wes. All right, well, everyone, tomorrow starting at 8 a.m. Eastern time, we will resume. I have 4 hours of that. I look forward to seeing you tomorrow.
All right. Thanks again.